different types of animals are used. These are mostly mice, rats, and fish, but also dogs, cats, monkeys, and big animals like horses, cows, sheep are also used in animal experiments. Thank you so much for this nice introduction, and good afternoon to everybody. I'm very excited to be here today and to talk to you about the disadvantages of animal testing. And I also want to show you some of the much more reliable, human-relevant and animal-free research methods and technologies that people already use. And at different times throughout my talk, I want to comment on common misconceptions about animal testing and on common arguments that we often hear from animal test supporters during discussions and other confrontations. I would like to start with a few words about our organization. Doctors Against Animal Experiments is an NGO in Germany. It was founded by physicians more than 40 years ago, and our main aim is to phase out all animal experiments for the benefit of animals and humans alike. We also aim to increase healthcare through prevention and to support the development, use, and dissemination of non-animal human-based technologies. So why are we against animal testing? Well, simply put, animal testing is bad for multiple groups. It is bad for the animals, of course, but it is also bad for humans and human patients, something that I will show you later today. And it is even bad for scientists and the development of science. And I want to start by shortly commenting on the topic of why animal testing is bad for animals. Of course, we have all seen terrible videos and photos from laboratories and know how immense the suffering of these animals are. I'm not going to show you such photos today, so don't worry. But I want to give you a perspective how many animals are affected in the European Union. So around 10 million of animals die in laboratories for experiments each year. And as you can see, these numbers remain stable since at least 2015. And in 2020, the number is a bit smaller, but this is mainly because of the lockdowns, because of COVID. And different types of animals are used. These are mostly mice, rats, and fish, but also dogs, cats, monkeys, and big animals like horses, cows, sheep are also used in animal experiments. So in addition to these 10 million animals each year, approximately 12 million animals are bred in laboratories for experiments, but are actually killed without being used in experiments. For example, because they are too old or they are not the correct gender that is needed for the experiment. So in total, at least 22 million animals die in the EU every year. And this is only the vertebrate animals. Invertebrates like insects or worms are not counted in these statistics at all. And the biggest fraction of animals used for experiments are used for basic research. This is an area of research that does not aim to find a specific application like a therapy or a drug, but to increase human knowledge. And then around 30% of animals are used in applied research. So here, some specific applications are tested. And between 15 and 20% each year are usually used for the so-called regulatory experiments. These are the experiments that are actually required by law. For example, when a company is testing a pharmaceutical product or a chemical product that has to come on the market. So at this point, I already want to highlight some of the arguments and misconceptions that we often hear. A lot of them aim to minimize animal suffering. So we often hear that comparison that compared to animals that are killed, for example, in factory farming or for meat production, the fraction of animals killed for experiments is very low. But actually this comparison is irrelevant because just because animals suffer and are killed for other reasons does not make it right for millions of animals to die for experiments as well. And as we have seen, the numbers are quite high. We also hear that the argument that animals don't suffer because researchers use painkillers, for example, or because the typical animal experiment is not so severe. People often compare it with taking blood for analysis. However, again, we have seen in many cases, in many investigations, that animals suffer severely, and also there have been multiple studies that even experiments that are not so intrusive can be very hurtful and painful for the animals, and that especially small animals like mice and rats hide their symptoms, so you cannot really appreciate their suffering so well. And the artificial conditions in which the animals are kept represent a type of suffering as well. And another argument would be that animals, that we have to test on animals because this is required by law. But as we have just seen, this is only a small fraction of the animals that are used. So now I want to speak about why animal experiments, animal testing is hurting human patients. And to appreciate this, we have to really appreciate the big differences between animals and humans. There are countless examples of anatomical, physiological, genetical, and structural differences between animals and humans. We live in different environments. We are very different biologically. However, there are also big differences between individual humans themselves. There are young or older people, there are people from different genders, from different geographical areas. So who are animal experiments supposed to model? And exactly in the same way, there are also individual animals. So animals, even from the same species, can have very significant differences between themselves. Therefore, you will never see an experiment where half of the mice are kept in Luxembourg, for example, and the other half in Berlin. And finally, the animal testing usually does not analyze the real disease that affects people, but only artificially bred symptoms in animals. For example, a very common way to study depression in rats is to put the animal in a tank with water and to see how long it tries to swim out of the tank. And if the animal gives up sooner than expected, it counts as depressed. However, this has nothing to do with the complex biological and socioeconomic reasons that lead to depression in people. So here is a very simplified scheme of the drug development process and the role of animal experiments. So each drug candidate has to be tested in at least 2 animal species. This is required by law in the EU and in most parts of the world. And after this, only the drug candidates that are safe and effective in these animals go to further clinical trials with human volunteers and patients. And the plan is that the good drugs will go afterwards, will be authorized for the market and will help more patients. However, the reality of this is that more than 90% of all drug candidates that are safe and effective in animals failed in these clinical trials, mostly because they don't work or because they lead to severe side effects. And not only that such a high percentage of drugs do not work, but this has been a stable trend in the last 60 years. And we see no improvement of these failure rates. And when we analyze the reasons for this failure, we see that the vast majority of the failure is caused by biological factors like inefficient efficacy or toxicology, which is a very good example why or how animal-derived data cannot be transferred reliably to humans. And there are many examples of substances that have been very harmful for humans in different ways and have been safe for many kinds of laboratory animals. But on the other hand, it is much harder to appreciate how many good drugs have there been, which could have helped people, but were toxic in animals or ineffective in animals. And here you see only 3 examples of 3 very widely used drugs, which are very safe and common for human use, but are leading to severe side effects in different animal species. So animal experiments fail to distinguish safe from dangerous drugs, and they also lead to patients being harmed and to opportunities of good drug substances being recognized. And you don't need to only listen to me, but also to the people who actually make the drugs. So in the recent years, some of the largest pharmaceutical companies around the world have spoken against animal experiments, and they have invested heavily in developing novel non-animal technologies, not because they care so much about animals, but because they see that animal testing is not working and that we need a better system. So now I come to the next round of arguments. So one very common argument is that we need animal testing to find safe and effective drugs, which we have just seen that is definitely not the case. The data from animal testing is not reliable and contributes to this high drug failure that we've seen. Some people say that all the drugs that we have today have been tested in animals, or all big discoveries that were granted Nobel Prizes, for example, were connected to animal experiments. And of course, if it is dictated by law that all drugs are tested, have to be tested in animals, everything at the end is tested in animals. But the drugs that we have today are not here because of animal experiments. They are here because they were safe in humans despite the low reliability of these animal experiments. And there are also a group of more emotionally charged and manipulative arguments like, so do you say that we have to test drugs directly in people, or should we, who would you rather save, your sick child or a mouse, for example? And at this point, again, we have to look at these failure rates because at the moment, we are testing drugs in human trials in people that have been tested in a very unreliable system. And of course, we don't want to test drugs directly in people, but we want to test them with more reliable and better non-animal methods. And I'm going to show you some of these methods now. So the most common term that is used is NAMS, which stands for New Approach Methodology, or non-animal methods. And there are many different kinds of NAMS. There is a category called in silico methods, which are computer-based methods. You can feed different software nowadays, often with artificial intelligence, and they can make very complicated and very accurate predictions about different parameters. Here is one example of a software that can predict the toxicity of chemicals with better sensitivity and more reliably than the usual animal tests used for this purpose. Another technology which is very widely used are the so-called induced pluripotent stem cells, or iPSCs. Very simply put, you can take just any cell from the human body, like skin cell or hair follicle cells, and of these cells, you can grow this type of stem cells, which you can then differentiate or use to grow the type of cells that you need and are not so easily accessible, like nerve cells. And here is one example of such use. So a few years ago, researchers in Charité hospital in Berlin were able to find a cure for the 15-year-old patient suffering from a rare disease. The patient was already in a coma, so in a very progressed stage. All kinds of animal experiments for this disease have failed. And through using this, his own iPSCs, there was a substance that showed potential of working, and the patient could recover so that eventually he could return to school. Another type of models are the so-called organoids. So from iPSCs like this, or from different types of human cells, you can grow three-dimensional miniature structures that have complex functions and internal structure that is similar to specific organ parts. And you see here only 4 examples, but nowadays you can grow organoids for basically all organs in the human body, and you can use them for all kinds of purposes. One example here is of 10 drugs which were tested in animals. They were perfectly safe in animals, and then in humans induced damage of the liver or in the heart. So when these drugs were later tested in human liver and heart organoids, 7 of these 10 drugs were detected as toxic. And another type of technology is the so-called organ-on-a-chip technology or body-on-a-chip technology. So here you go one step further. You can take different types of cells or different organoids and connect them on one platform that looks like a chip. And they're connected with each other through microchannels and can exchange substances. So you can see the interactions between the different cells. And again, this is one technology that today is very widely used and gains popularity. So in a very similar to the previous example, here 15 drugs that were tested and were shown to be safe in animals, were tested in over 800 human liver chip models. And out of these 15 drugs, the liver chips detected 12 as toxic. So these are only a few examples, but actually there are thousands of different types of non-animal methods and technologies. And because it is not always easy to find what is already there or what is suitable for the different purposes. A few years ago, we launched the NAT database. So NAT stands for Non-Animal Technologies, in which we gather such examples and such studies. And currently, the database has over 1,800 entries. It is freely accessible in German and English. It has multiple filters, so if you want to look for non-animal methods in different research fields or from a different country, you can do this. And it is for different stakeholders. It is for the researchers, for students in biological sciences or biomedical sciences, and also for the general public. And we were very fortunate that that database was also awarded some prizes like the Lush Prize for training in 2022. So now I come to the next set of arguments that we often hear. Maybe the most common argument that we hear is that we need a whole organism and that these technologies are not complex enough. And at this point, I want to stress that we don't need complexity, but we need reliability, because animals, of course, are very complex organisms and complex systems, but what does this bring us if we don't we cannot draw reliable conclusions for the human condition and human reactions? So also there are technologies, there are NAMs, non-animal technologies, that are very complex and contain, for example, immune components, simulated blood circulation networks, and these technologies have a very big potential for improvement, which cannot be said for animal experiments. And the next argument is that you cannot test everything in organoids. For example, behavior. Many people cite behavior. And this is true. You cannot test behavior of humans in organoids, but you also cannot test human behavior in animals. And also, there are other methods to test different questions which are ethical, like, for example, ethically justified human trials with informed consent. Another common argument that we hear is that if animal testing is banned in the EU, many researchers will move to other countries with lower standards of animal welfare. Many times China is cited. And I want to say that some of the countries in the world that have some of the strongest research programs are currently developing plans to phase out animal testing because they want to increase innovation through non-animal methods, and they want to foster this new field of more reliable research. And the European Commission has recently announced that such a plan should be made here in the EU as well. And now, at the end, I want to say why are animal testing also hurtful for the development of advancement of science and for scientists. Many of the reasons are similar to the reasons why animal testing is bad for human patients in medicine. First of all, of course, if you have an unreliable test system or unreliable setup based on animal data, you often come to the wrong conclusions. Also, resources in science in terms of money, in terms of work power are limited, and in the moment there is a big waste, a lot of resources are devoted to animal experiments that are going nowhere. And also, there are studies that show that over 99% of discoveries or results in basic research never reach any application, which is not the ideal idea of conducting research. And also the people who perform the animal experiments themselves often suffer from depression, anxiety, and stress, because this is a very unnatural thing to do, to induce this suffering to animals. And especially for young people, for students or for young researchers who have their first experience with animal testing, this is often a big reason to quit biomedical sciences altogether. And this leads to talent loss in this case. So now I want to just quickly say what each of us can do against animal testing. The first thing and the most important thing is to be informed and to speak about this subject. It is a very complex subject, and as we've just seen, there are many arguments from animal test supporters, but if we are informed, we can argue in a logical way against these arguments. Also, if we are researchers, of course, we can choose not to test on animals, and if there are biomedical students, or if you know some biomedical students that are forced to do some animal testing for their training, there are usually a lot of possibilities to avoid this, so they can contact their local NGOs. We can, of course, as consumers, choose cruelty-free products. And I want to say just that not all products that are labeled as vegan are automatically also cruelty-free, so not tested on animals, but some official labels, like the ones that you see here, also exclude animal testing. So if you choose such products, they have not been tested on animals. You can also, of course, sign petitions, support your local NGOs, and just stay informed and stay interested in these topics. So now I want to come to the end, and I hope I could show you that animal experiments is bad for everybody, not only the animals, but also the humans and for science itself. And that there are multiple diverse non-animal technologies, which are the correct way or the way that science should be made to advance human health, and that we urgently need a change and to apply these technologies. So thank you so much for your attention, and I'm happy to take your questions.